remember, you do not need alphabet soup. And one thing that I have realized sometimes when I see this is you are setting the bar. If you have alphabet soup and you have every certification under the sun, you are then setting the bar incredibly high for your interview. Meaning, if you have CMC, CSC, CCRN, blah, 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 you better, like, if they start drilling you on critical care knowledge, you better be sharp. Unfortunately, I don't think you need to do that. And I think you could also be setting yourself up to have a really grueling interview process to where if you're not like at the top of your game, they're going to be like, well, why do they have all these certifications? So just be careful with that. Again, it's not bad. Definitely have one, having two, cool. But any more than that, I think your time may be better spent doing other things to really boost your application for CRNA school than just continuously getting certifications. Well, hello, future CRNA. Welcome back to CRNA School Prep Academy podcast. I'm your host, Jenny Fennell, and today we're going to talk about how to become an ICU nurse. Many of you who are contemplating becoming a CRNA may realize that you first need to start in the ICU. So today we're going to discover or reveal what it means to become an ICU nurse, what it's like to be an ICU nurse, what types of units you can work on, what the salary of an ICU nurse is, and so forth. So let's go ahead and get into today's show. All right, hello, welcome back to CRNA School Prep Academy. Today we're going to talk about becoming an ICU nurse. And for those of you who have aspirations to become a CRNA and who know that your first step needs to be becoming an ICU nurse, this episode is for you. So first, what is an ICU nurse? What do they do? What is it all about? So an ICU nurse is a critical care nurse who specializes and is highly trained to care for critically ill patients. They also can get additional training in advanced life care support modalities such as CVVHD, ECMO, Impella, and so on. So again, an ICU nurse, really think about it as they provide care for the sickest of the sickest population. It could be any age range, any type of illness, any type of trauma. And that is what an ICU nurse cares for. So what is their typical work environment like? What is their typical shifts like? And so forth. So this really depends on the type of ICU setting that you end up choosing, which we will get into here in just a moment. But typically, as most nurses do, you typically work, a range of 8-hour shifts or 12-hour shifts. And you either work day shift or night shift. I will say it's more common to work night shift as a new grad ICU nurse or some type of day-night rotation. I remember the hospital I started at, which was a level 1 trauma center, magnet status hospital, of academic center, and to be able to go to straight days, the nurses who had about 6 to 7 years of seniority were the ones who got to go to straight days. So I remember that feeling really heavy as a new grad, knowing that I'd have 6 to 7 years of toughing out night shift before I'd ever see the light. And for me, in my experience, I found the day-night rotation to be much harder on me physically and mentally. So I made the choice, if I was going to be miserable going back and forth all the time, then I might as well just make more money all the time and go to straight nights. So after about, I would say, a year, or probably about a year of day-night rotation, I went to straight nights. That is also the year that I was preparing my CRNA applications. And luckily, I was accepted, making my overall ICU experience right around 3 years. By the time I started my program. So what do ICU nurses do more specifically? So this, again, where it depends on what type of unit you work on, whether you work in a medical ICU, surgical ICU, CV ICU, it'll depend on the type of patients you care for and what disease processes they have, or what medical complexities they have. But ultimately, if you look at overall, your job really is to evaluate and monitor the patient's progress, to identify any sudden or subtle changes in the medical condition. I will never forget my first cardiac arrest in the ICU. That experience will always stay with me, mostly because the situation was, it was traumatic for me to experience that for the first time. I had experienced cardiac arrests as a nurse's aide because I was a nurse's aide, which I will also share with you a little bit later. But my first cardiac arrest was a patient who had ITP, which stands for idiopathic thrombocytopenia. And I was a medical ICU nurse, and this patient was young. They were in their 30s. They had young kids. And I remember coming on my night shift that day, and they asked to call their family. They were a walkie-talkie, as we would call them, because it was very unusual to have a walkie-talkie on our unit. They were actually already waiting on transfer to a different unit, to the floor, to the step down. And so they didn't even have the ICU docs as their main providers at that time. They were just waiting for a bed. And anyways, so they talked to their kids and their husband and went on like a typical night until it did not. And I went to do my 2 a.m. Blood draws, and the patient's eyes were wide open, and she just was staring into space. And I tried to talk to her, try to communicate with her. She said nothing to me. She looked at me, but she said nothing. And it was just acting very strange. At first, I'm like, oh, you're having trouble sleeping. Can I do something to help you? I was thinking maybe I was being too loud or disturbing. In that ICU, we didn't have doors. We had curtains. It was just a row of curtained rooms. That was our ICU. And anyhow, didn't talk. And so I started doing a neuro assessment. So that she was acting very strange. And I'll never forget seeing her pupils go big, then small, big, then small, big, then small. And I was like, oh, and I mean, immediately knew that she was having a stroke. Didn't know how severe it was. Tried, went out and had another ICU nurse go into the room to stay with her. While I went and called the doctors, and I went and got the ICU team, even though they were not her primary team. I said, you got to get in the room right now. She's having a stroke. I'm going to call her transfer service that she's on, but she's having a stroke. So you need to go in there right now. Long story short, by the time I even got a hold of her actual team of doctors, she was already massively stroking, and saw the Cushing's triad, which is, if you Google it, it's essentially where you start herniating your brain, and you have bradycardia, hypertension, and eventually you go asystolic. So, I say that, and it's, like I said, it always sticks with me. And I don't mean to bring some doom and gloom to the situation, but ultimately, if you're considering becoming an ICU nurse or you want to pursue CRNA, you have to become an ICU nurse. And this is just one example of what you will routinely see in the ICU. I'm going off on a tangent now, but that being said, working in the ICU can be an incredibly emotional, mental struggle. It was definitely some of the darkest days of my career. I don't regret it. I am grateful for becoming a CRNA. I love it. Could I have lasted in the ICU for my entire career? Absolutely not. It took every patient death, everything so personally, and felt the pain emotionally, that it became very taxing. So I cannot imagine what just has unfolded over the last several years with the pandemic and seeing that much patient suffering and death. It definitely takes a toll. That being said, there are ways you can cope with that, and you definitely need support to become an ICU nurse. So I think step number one is, obviously research what type of ICU nurse you want to become. Step number two is really think about how you plan to support yourself during your time as an ICU nurse. This is something that I did not think about until I was already in it, and it became very heavy. And I really didn't know what to do. I didn't have a plan. I didn't really know who to reach out to. I didn't really know if I felt comfortable talking to a regular therapist, considered going on antidepressants. I would say, looking back, I leaned a lot on my fellow ICU nurses for support. And that was what got me through those hard times. My coworkers were like a second family. I call them my work mother and fathers, because that's what they felt like to me. I was young. I was 22 years old. That seems like, that's like a baby to me now. So I guess have a plan in place to provide yourself some type of mental space. It's not a bad idea to think about getting a therapist that like, and trust. So that way, if you have a really traumatic experience, you have someone you can talk through that with, who can understand how to help you cope with that grief and that loss. So these are all things to really consider and think about as you embark on your ICU nurse journey. So back to what do ICU nurses do? They do take care of life and death situations. They run codes. They titrate vasoactive drips. They delegate. That was a big part of being an ICU nurse, is to delegate, especially in a critical situation. I will never also forget a situation where I had a GI bleed, and those were nobody's favorite patients. Not only was it just, it was critically a dire situation, but it's bloody poo, which is not so pleasant, right? And it smells. It has a really, really distinct smell. Not to just, this episode's getting totally gross, but anyways, I just remember giving a massive transfusion, like just blood product after blood product after blood product, checking labs. It was all hands on deck, and I needed a massive amount of help from my team. So I had to ask for help. I had to delegate tasks to nurses who came in my room. I had to know what needed to be done, and I had to be okay and comfortable asking for it. Now, that's not the type of assignment you get on day one in the ICU. But that is, you'll be managing patients who require massive fluid and blood protocols. You'll also be managing patients like DKA, which is diabetic ketoacidosis, who, their electrolytes are all messed up. They're, acidotic, and, you'll be managing people who have ARDS, which is acute respiratory distress syndrome, who need intubated, and their lungs are essentially full of liquid and water. And even with 100% oxygenation or 100% FiO2, they're not oxygenating, and they're getting more and more acidotic. They can actually turn into DIC, which is disseminated intercoagulopathy, where you essentially you bleed and you clot at the same time. DIC is a terrible process, and it's not many survive. Because once that cascade of clotting and bleeding start, it's incredibly hard to ever stop. So things of that nature. So again, these are very, very serious conditions. Those are just some of give you an idea of the types of patients. Now, my background, obviously, talking about all these patients, is a medical ICU. So we can, if you're in the surgical ICU, you're going to be dealing with trauma, with neuro, with surgical patients, such as maybe someone who had a liver transplant. But they have hospitals and ICUs that just take liver transplants. Maybe you're a major liver transplant center, and that entire ICU is dedicated to liver transplants. That is a real thing. So know that ICUs can be incredibly specialized. You can have an ICU just dedicated to burns. So again, it might be part of the CICU, but maybe there's a burn unit within the CICU. So again, it just depends on what unit you work on as far as the types of critically ill patients you will take care of. Obviously, other responsibilities of a nurse in the ICU is to talk to your team, is be an active participant on rounds, which all nurses do those types of things. But I think in the ICU, it becomes more. It definitely is seems to be a much bigger part of your role, because those physicians rely on you to communicate these changes, because you are at the bedside 24/7. You don't leave that patient's side. Typical ratios for ICU nurses are 1 to 2. Now, in the past few years, I think that has crept up sometimes to 3 patients, potentially, maybe even 4 in the pandemic stages or whatever it was. But that is really not safe, because you could have a stable double, is what they would call it. And that stable double can turn into 2 critically ill patients, or 1 really critically ill patient who needs all of your time and attention. And the other one is not like they're a walk in the park either. They're just not actively dying. So it can go south really quick in the ICU. So usually it's 1 or 2 patients is the ratio. I always enjoyed having a 1 to 2 ratio. It really allowed me to pour and give my all to the patients I had, versus, something like med surg, where you have 6, 7, 8 patients and you're spread really thin and you don't get that much time with your actual patient. So I enjoyed the low ratios that you would experience in the ICU. It also allows you, again, to go more in depth with your patient, meaning what's your disease process? Why are you on these drips? Why are you taking these meds? Why are we doing these therapies? These are all really enjoyable things that you get to do as an ICU nurse. And if you love pathophysiology and you love pharmacology, ICU nursing is really cool. You will learn a lot. I mean, it is just every day is a new experience. Every day is a learning opportunity. And if you treat it like that, you will be way more successful in your pursuit for CRNA than if you just walk in and just take orders and do your thing and follow. You really want to be the scientist. You want to ask why. If you really operate like that from day to day, you will be leaps and bounds ahead of any competition for CRNA school.
Hey, future CRNA, another daily dose of inspiration along your CRNA journey. In today's success story, we're going to share kind of an untraditional experience from one of our students. So the post reads, "I'm so excited to post I was accepted into CRNA school. I interviewed at my dream school. The meeting and panel showed me that this was really not the place for me. Although it was close to my home, the culture and I weren't a match. So after a bit of a traumatic interview experience, I was invited to interview at another school. Side note that I applied to 3 schools, waitlisted at 1. The negative feeling was mutual at my top choice. They accepted at the program that became one of her dreams. Anyway, I called and spoke with the director before the interview, and within minutes, I was excited beyond words. There was a warmth and character that resonated with me. I moved forward with the interview. A couple hours after the interview, they offered me a position in the cohort for the spring. Mind you, the application was for spring 2024, not 2023. So what an incredible surprise that I get to start my journey a year earlier. I don't think this would have been possible without CRNA School Prep Academy and my mock interview. Larissa was fantastic for the mock interview and helped me get over unsettling experience from my former dream school. The podcast, lectures, resources, mock interview, all CSPA had to offer made this possible. Thank you so much. Don't give up. Don't be afraid to be untraditional in your career path. Study and believe in yourself. Things turn out the way they are meant to be." I just love this so much because while this student had an unfortunate experience at what they thought was their dream school, they turned it around. And they also were waitlisted at a school that didn't start till 2024. And when they got asked to interview at the 3rd school, they were so shaken up by their previous experience that they decided to call and talk directly to this program prior to even interviewing. Now, mind you, they had already knew they had a seat at a school, but didn't start till 2024. But after talking with this other program faculty, they knew they had to give themselves a chance to interview. They felt instantly connected to this program faculty, and they were so happy they did because they got in just a few hours after the interview, and they get to start CRNA school an entire year sooner. So I wanted to share this with you because I thought this was really inspirational. And it just goes to show that kind of what we have preached before in the show is that this is a two-way street. You are picking your programs, and you may have your dream program in mind, but the reality is it may not be the right fit. And you may have to kind of improvise and pivot to a different school. And it may actually turn out to be the best decision for you ultimately is to not get into what you think is your dream school. So go into it with an open mind. I'm rooting for you. Thank you so much for sharing this story. Congratulations. You know who you are, and I'm always cheering you on.
So ICU nurses, they, again, manage vasoactive drips, paralytics. They give vasoactive drugs and narcotics. They keep their patients comfortable. Sometimes your patients are on the ventilator, so they need continuous sedation with things such as propofol, also called Diprivan. It's the white medication, also known as the Michael Jackson drug. I've thrown it out there. For a while there, everyone was like, "Oh, they're giving me the Michael Jackson drug." I'm like, "Oh my gosh!" But it's propofol is the name of the drug. Very commonly used in the ICU for sedation. But you could also have them on a Precedex drip as well, which is also called dexmedetomidine. So we just kind of covered where ICU nurses work, but just to kind of cover some different specialties. There's a cardiothoracic ICU, which is also abbreviated CTICU, but you can have a variety of cardiac ICUs. You can have the CVICU, cardiovascular ICU. You can have the CCU, which is just the cardiac care unit, and it can kind of have like post-MI patients and things like that. So there are blends of cardiac ICUs. Medical ICUs are relatively, standard medical ICU. But you can also have a mixed ICU, meaning it could be surgical and medical ICU combined. You can have, which this gets confusing, you can have a neonatal ICU, NICU, right? But you can also have a neuro ICU, also a NICU. So those could be kind of confusing. You want to make sure you're differentiating between, does the NICU mean neonatal ICU or does it mean neuro ICU? A lot of times neuro ICUs are kind of lumped into the surgical ICU. So know that, again, a lot of SICUs have neuro patients on them, but some hospitals have a very specific neuro ICU only. Then you have the PICU, which is a pediatric ICU. Pediatric ICU is really great. You see a wide range of patients, all the way from babies to teenagers. A lot of CRNA schools do take a pediatric ICU experience. However, the neonatal ICU, not so much. That is considered a very, very niche part of ICU nursing, and it's incredibly specific for the neonate. So it's not as good of an experience for CRNA school, and therefore a lot of programs do not accept experience from there. So just make sure before you pick your ICU that you're researching what your school takes. And if you see the words individual basis, that's a red flag to know that's not a preferred experience. They will consider it if all else looks great, but it's not going to be competitive. And given how competitive CRNA schools are, I would go with the preferred experience, but don't write yourself off if you do have a less than preferred experience. Still go after it, still get it. You got it. I know you can do it. I just like to warn you ahead of time if you have the choice to try to pick up unit that is preferred by your CRNA program versus one that is not. Then you have the surgical ICU, which again can be a surgical neuro, could be a surgical burn, could be a surgical trauma. So there's a variety of different types of surgical ICUs. So know that there's some variation in that. And I want to mention things like flight nursing. Flight nursing I see that a lot, and it's a good experience. Typically to become a flight nurse, you need to have really solid ICU nurse background, which is why it can also work as a pre-CRNA experience. So again, the reason why it tends to work is because you have a solid ICU background first, and the experiences you get as a flight nurse, such as intubations and kind of almost being like the first responder, is a really good experience for CRNA. You don't need to be a flight nurse, but I'd also encourage you to double check, because a lot of CRNA programs tend to not see units or experiences that are short-term management as true ICU experiences. The caveat, a lot of people are like, well, why would flight nursing work and not ER nursing? Because they're both kind of like triaging and doing, quick stabilization and then getting the patient somewhere else. The difference really is the fact that an ER nurse has a lot less autonomy, and they don't do things like intubations and things of that nature. And they also have a wealth of resources around them, where a flight nurse is really on the field and doing the intubations, and really just has a very small team to work with. And is really taking a lot of action autonomously. And the big difference is an ER nurse might not have really solid ICU background, where the flight nurse will. So that is really the big difference. But again, I would confirm with your CRNA program that flight nursing is an okay bridge after you've had solid ICU experience to then be considered current in the ICU. I would say the majority ones that I have come across do take flight nursing, but it's still worth asking to make sure that, again, you don't pick a unit that would set you up, or pick an experience that would set you up to be less competitive for your program. All right, so what are the steps to becoming an ICU nurse? I really think step number one is in nursing school to get experience as an SNA, CNA, a student nurse assistant, because that way you can kind of explore different ICUs and really understand what it is you're getting yourself into, and kind of like see the work that the nurses are doing. It also gives you gets your foot in the door, gives you like a good reference. So that way, if you apply to a nurse residency program for the ICU, you're more likely to get it because you'll have a good reference. So my biggest piece of advice for you is to take your role as an SNA or CNA in the ICU as a long-term job interview, because these nurses that you're working with as an SNA will be the ones who support you and guide you to become a nurse on their unit. So that is really, in my opinion, step number one. Obviously, step number two is you have to get your nursing degree, whether that's a BSN, whether that's your ADN. A lot of magnet hospitals will now only take BSN prepared nurses, because that is part of the magnet criteria of some kind. I don't know all of it. I just know it has to do with that. So be cognizant of that. So if you pick a hospital where, if you're getting your ADN and you're picking a hospital, that only takes BSN nurses in the ICU, you may be kind of setting yourself up to not be able to get in right away. So I would think about that prior, or maybe your hospital will take you as an ADN prepared nurse, knowing you're going back within a certain time frame for your BSN. That is kind of like the hospital I worked at. That was kind of the understanding, was if you were hired as an ADN nurse, you were going back for your BSN relatively quickly after you were done with your ADN. So those are all things to think about and look into prior to picking your role as an SNA. But getting your BSN, your ADN, those are all bridges to becoming an ICU nurse. So getting experience, you want to, find what unit resonates with you. However, I don't encourage you to jump around too much, because especially if you want CRNA, because you want to establish good leadership roles, you want to establish good references. In order to do that, you need to stay put. If you're job hopping every year, it's going to be really hard for you ever to build up a lot of leadership roles or experiences and really good references. Plus, it also could come across as a red flag to these admissions committees that, like, what's wrong? Why can they not stay put for a while? It's not wrong to move around if there's a reason for it. Maybe you move, maybe whatever, maybe you had a toxic unit. I don't know. It's not wrong to move, but just deliberately to pick a unit to jump around on is sometimes people, I don't know why this always gets in people's heads, and I'm not sure where it's coming from, but it happens often where they're like, I need a well-rounded experience. I need to have CV-ICU and MICU and SICU. I need to have it all. That's just not true. Pick one that you like, stick with it, grow, become the best nurse on that unit, take the sickest of the sickest patients, get leadership roles, do charge, do whatever, and build that establishment there, and then go to CRNA school. You'll be fine. I only had MICU experience. I did just fine in CRNA school. I didn't need CV-ICU. Everybody has a heart, including MICU patients. So you know what? At the end of the day, does it really matter? No, as long as it's solid ICU experience. Remember, quality over quantity. You want quality ICU experience. We like I said, we took the sickest of the sickest. They didn't ship these patients out. They got shipped to us when they're on their last thread. I always tell pre-CRNA students inside CRNA School Prep Academy that if your patients in the ICU get shipped somewhere else because they become too acute or sick for your unit, you want to get in your car and follow the ambulance and apply for a job at that hospital, because you want to be the endpoint. Your patient either leaves or they don't. Like, that is your unit. And so if that's the kind of ICU you work in, you have found a good ICU. It doesn't matter what type. As long as you're happy and you're thriving, you feel supported, that's what really matters at the end of the day. All right, let's go into ICU certifications. You don't need alphabet soup. Let me just start there. But I would plan on having at least one critical care certification, primarily the CCRN. And the reason is because most CRNA schools either require it or they recommend it. Recommend, hint, hint, wink, 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 wink. I can't do that very well. Do it if you can. Now, sometimes you're not going to have the amount of experience. It's 1,750 hours that you would need. And that's equivalent to about 1 year of full-time, 36 hours a week of ICU experience to sit for that exam. You must have that amount of hours prior to even applying to take the exam. I actually had to ask that question because someone wanted to apply before they had the hours. And they're like, no, you have to have the hours first. Then you can apply to take the test. But that is really the exam that I recommend the most, because it is the most widely accepted and recognized by CRNA schools. Now, of course, if you have, there's other additional certifications such as the CMC, which is for nurses in the medical ICU. You can have the CSC, which is for surgical critical care. You can go on and on and on. There's neuro ones. There's all kinds of additional certifications. If you go to the AACN's website, you will find additional certifications that you can take as an ICU nurse. They are all listed there. But remember, you do not need alphabet soup. And one thing that I have realized sometimes when I see this is you're setting the bar. If you have alphabet soup and you have every certification under the sun, you are then setting the bar incredibly high for your interview. Meaning, if you have CMC, CSC, CCRN, blah, 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 you better, like, if they start drilling you on critical care knowledge, you better be sharp. Unfortunately, so I just don't think I don't think you need to do that. And I think you could also be setting yourself up to have a really grueling interview process, to where if you're not like at the top of your game, they're going to be like, well, why do they have all these certifications? So just be careful with that. Again, it's not bad. Definitely have one, having two, cool. But any more than that, I think your time may be better spent doing other things to really boost your application for CRNA school than just continuously getting certifications. Um, all right, getting involved in the AACN is a great leadership activity. So that is definitely something to put on your radar. Let's see what else to talk about. So what do you make as an ICU nurse? I think a lot of you are probably wondering, well, if I go to ICU nursing, is it going to be realistic that I can save for CRNA school being an ICU nurse? So that being said, according to the Bureau of Labor and Statistics, this ICU nurse employment is projected to grow over 6%. That's more than average. So again, this is definitely considered fast when compared to all occupations. The average salary for an ICU nurse is about $90,000. I took this from Incredible Health, recent data. But there's a range. There's a range of 80s. I mean, you could be in an area of the country that maybe you only make $70,000 as a new ICU nurse. I have heard that. In fact, I was walking through my hospital and I had a team of PICU nurses behind me, and they were just chit chatting. Maybe I was being nosy. And they were saying they were only making $31 an hour. So that's equivalent to about $62,000 a year. Now this is in Ohio. So again, I don't assume you're going to make $90,000 a year. Just know that it's going to depend on the area that you are working, whether you're doing travel assignments, all of those things go into play. I would say set your expectation, to be in a range, but start researching to kind of understand what you can expect where you live. I also have a cousin who, she doesn't live near me, but she's an ICU nurse. And now where does she live now? I don't know. She's in Ohio randomly, but she's also traveled. But I know in Ohio, I think she was making $35 an hour at another Ohio hospital as a brand new ICU nurse, which is $70,000 a year. She now then started traveling to make more money. So just know that I got this $90,000 thing, but I'm like, I know that's not always accurate depending on where you live. Now you're probably wondering, how does that compare to being a CRNA, Jenny? So a CRNA salary, you can always expect a CRNA salary to be at least $100,000 more dollars as a brand new CRNA than a brand new ICU nurse. So as if an ICU nurse, you're making $70,000 as a CRNA, a new CRNA, you could be making right around $170,000. So that's kind of a good rule of thumb to kind of go by. Now, is it going to vary? Yes, it's going to vary. Depending again on whether you're a 1099, whether you're doing locums, what they call it. It's kind of a similar avenue to like PRN nursing or travel nursing, but they call it locums, or whether you're a W-2. Obviously W-2, you make a little bit less. According to the survey done in 2022, 2023 by the AANA, the median CRNA, let me just make sure I double check these numbers here. The W-2 median CRNA salary was $235,000 as the median. That was for full-time employed CRNA. So they were making $235,000 a year. So what is that? That's that's over $107 an hour ish. If you were to put it in per hour terms, $110 an hour around there. Now a full-time self-employed, meaning 1099 in 2022, the median was $272,000. So again, whether you're working W-2 or whether you're working PRN, locum, your salary is going to fluctuate per hour. But I always say, like, a good rule of thumb is that a CRNA typically always makes at least $100,000, if not more, per in a salary compared to an ICU nurse. All right, so I think that wraps up the majority of this episode. I just want to leave it with that ICU nursing is hard. Being a CRNA, becoming a CRNA, it's hard, but it's equally incredibly rewarding. So I wouldn't get discouraged, especially, I know I kind of started this episode with some doom and gloom, but I wanted to be realistic and paint a realistic picture of what you should be expecting as an ICU nurse. And it is definitely not all rainbows and sunshine. It's just the opposite. It's a lot of storm clouds, but it builds a really solid foundation, because as a CRNA, while the majority of your cases are smooth sailing, when things go wrong, they go wrong really, really quickly. And you falling back on those skills you develop as a critical care nurse save patients' lives. I mean, it will save you. It will allow you to react under pressure. And that is one thing that as an ICU nurse, you get really good at is dealing with pressure and dealing with critical conditions that are life and death, and being able to operate in those conditions. It kind of it just prepares you for that. And so as a CRNA, when something goes wrong and, 1 minute it was all great and next minute it's not, or maybe you're getting a crashing patient to the OR, which does happen, you fall back on those ICU skills. So it's hard, but it's worth it. It does pay off. Making sure that you get quality over quantity, remember. So follow the ambulance to wherever they're taking your patient. It doesn't mean that rural ICU experience is a no-go. You can be accepted to CRNA school with a rural ICU experience. That is not a trauma level designation. However, you want to really make sure that you're still taking care of really critically sick patients, patients that are requiring advanced life modalities, advanced life support modalities, such as CVVHD at minimum. Seeing an occasional ventilator or doing occasional vasoactive drips may not be enough, given how competitive CRNA school is. And the reason why people always say level 1, level 2 is because the CRNA programs who are evaluating your resume can be certain that those are going to be high acuity units, where they're a little more unsure about a rural community hospital. You have to really, your resume has to be tip top, meaning you have to make sure you're really clearly conveying what you have done as a rural community nurse in the ICU. Because again, keep in mind, if those patients that you're taking care of are so critically sick that they have to be shifted in their hospital, it's a probably good indication that you're not taking care of sick enough patients, because the nurses that are getting that really critically sick patient are the ones who are also applying to CRNA school. So just something to keep in mind. I know it's kind of disheartening, especially if you have to relocate and move far away just to get ICU experience. But the reality is you're probably equally going to have to move away to go to CRNA school, because CRNA schools are usually in bigger cities. So, it may be one of those things where you just consider like relocating for the time being until you're done becoming a CRNA, and then you can move back home. I've had nurses tell me that they actually find like a midpoint where maybe they don't have any level 1 ICUs or any high acute ICUs near them, but the nearest CRNA school, they may be moving in between point, so they can still get be closer to family, but then have easier access to go to work. So maybe it's an hour commute each way, but they now have like a midway point where they can make both work. I know that may not sound like realistic or even achievable, so you just have to know your own situation. But just those are things that I have heard students within CRNA School Prep Academy do to achieve their goals. So I'm rooting for you. I hope you guys enjoy, and I hope you guys all become ICU nurses and then CRNAs. And then until next time, take care. Bye-bye.
Hey, future CRNA, as always, I appreciate you and your loyalty. Thank you so very much for tuning in this week. I'd love to hear from you, so screenshot this episode and share it to your IG stories with your biggest takeaway. Don't forget to tag me at CRNA School Prep Academy so I can personally thank you. Be sure to head over to CRNASchoolPrepAcademy.com to check out our blog and gather free resources to help you along your CRNA journey. Stay strong, and I'll see you next week.